Diagnosis of endometrial cancer. Diagnosis. Tests and procedures used to diagnose endometrial cancer include examining the pelvis. During pelvic exam, your doctor carefully inspects the outer portion of your genitals, uvula, and then inserts two fingers of one hand into your vagina and simultaneously presses the other hand on your abdomen to feel the uterus and ovaries. He or she also inserts a device called a speculum into your vagina. The speculum opens your vagina so that your doctor can view your vagina and cervix for abnormalities. Using sound waves to create a picture of a uterus, your doctor may recommend a transvaginal ultrasound to look at the thickness and texture of the endometrium and help rule out the other conditions. In this procedure, a wand-like device transducer is inserted into your vagina. The transducer uses sound waves to create a video image of your uterus. This test helps your doctor look for abnormalities in your uterine lining. Use a scope to examine your endometrium. During a hysteroscopy, the doctor inserts a thin, flexible tight tube hysteroscope through your vagina and cervix into your uterus. A lens on the other hysteroscope allows your doctor to examine the insides of your uterus and the endometrium. Removing a sample of tissue for testing. To get a sample of cells from inside your uterus, you will likely undergo an endometrial biopsy. This involves removing tissue from your uterine lining for laboratory analysis. Endometrial biopsy may be done in your body or face and usually doesn't require anesthesia. Performing surgery to remove tissue for testing. If enough tissue can be obtained during a biopsy or if the biopsy results are unclear, you likely need to undergo a procedure called as dilatation and curettage. During D&C, tissue is scraped from the lining of your uterus and examined under microscope for cancer cells. If endometrial cancer is found, you will likely to refer to a doctor who specialized in treating cancer involving the female reproductive system, gyneco-oncologist. Staging endometrial cancer. Once your cancer has been diagnosed, your doctor works to determine the extent stage of your cancer. Tests used to determine your cancer stage may include chest X-ray, a computed tomography (CT scan), positron emission tomography (PET scan), and blood test. The final determination of your cancer stage may not be made until you undergo surgery to treat your cancer. Your doctor uses information from these tests and procedures to assign your cancer a stage. The stage of endometrial cancer are indicated using Roman numericals ranging from 1 to 6, with the lowest stage indicating that the cancer has grown beyond the US. By stage 4, the cancer has grown to involve nearby organs such as bladder or has spread to distant areas of the body.